In May 2012, Vanguard Healthcare was invited to Stormont in Northern Ireland to show members of the Assembly what it has to offer. One of Vanguard's fleet of mobile operating theatres arrived by road and was exhibited at the foot of Stormont's grand entrance. Ministers were interested to open the box on what Vanguard could offer the people of Northern Ireland. One of the first visitors was Edwin Poots, Minister for Health, Social Services and Public Safety in Northern Ireland. A primary interest was delivery of care closer to the community.
So is the opportunity here to actually do something much more significant? And, I think it's the benefit of patients, where someone isn't having to go down to the Royal or Alton McGill or travel 30-40 miles.
I think for our unit, it's an enabler. We never say we're a substitute for bricks and mortar, but we can be a good interim solution.
Yeah. Very good. It's quite amazing.
During the course of the day, numerous MLAs gave up their time to visit the theatre and see for themselves, including Deputy Chair of the Health Committee, Jim Wells.
So if things are getting really on top of a hospital, you can bring this in and you've got an extra operating theatre.
The primary use of Vanguard is for additional capacity to enable the existing healthcare provider to do more work in the existing facilities that we've got.
The Compton Review has obviously, gathered a considerable degree of concern, and that is creating all sorts of operational issues, let alone concern in the community about, is my local hospital going to be in existence? Yeah.
But if you say, I'm going to replace that hospital with something different that's high-end and gives you great quality
and we're bringing
care,
the car to you.
Yes.
it can really sweeten that pill.
The concept was completely different to what it is. It's outside the box.
Senior personnel from a number of health trusts also attended.
And that's where we find the real advantage of one of these, because we are now at our physical capacity. In Northern Ireland at the minute, we have a demand for orthopaedic surgery which continues to grow year on year, and we struggle to meet that currently with our fixed theatre capacity. So whilst we are planning for the future and looking at a new build for theatres, etc., it is useful to have access to a temporary solution which Vanguard provides.
We're trying to explain to the important decision makers in Northern Ireland that there is an alternative for them. It's about making sure that they understand what those alternatives are for their decision-making process. People are very impressed by the quality of our product. Everybody, without exception, has said this is something that they could see being part of the local health service.
With pressure on existing hospitals increasing and patients demanding a more localised service, flexible mobile facilities like Vanguard's may have an increasingly important role to play in the provision of healthcare in Northern Ireland.